that we're talking about is chest tightness that's related to your heart. And what we think that the reason people experience chest tightness is that there is a blockage in one of the heart's arteries, the coronary arteries, that is preventing enough blood to get to a certain part of your heart muscle. So just as if you were to put a tourniquet around your arm, after a while, your fingers and the muscles in your fingers would start to hurt. That's the same thing that's happening to the muscle of your heart. So if you're developing chest pain that's related to your heart, people will often say it's a squeezing, and they'll squeeze their hand like I'm showing you now. That was one of the earliest descriptions of angina, which is another word for heart pain. If someone develops angina while they're exercising, the first thing to do is stop exercising and sit down. Of course, when somebody has chest pain, it has to be in the context of who they are. Just as if you were to sneeze repeatedly in the middle of a flower shop, you wouldn't say, oh my goodness, I have COVID. Your first thought is, I'm allergic to some flowers here. So for example, if you're a 21-year-old healthy person without any medical problems at all, and you've just eaten a whole kielbasa sandwich with lots of peppers and onions, and you get chest pain, you're not having a heart attack, you're having indigestion. On the other hand, if you're over 50, and especially if you have high blood pressure or diabetes or smoke cigarettes, and you've just been exerting and walking briskly after a heavy meal, and you develop chest tightness, it's really important to stop walking, reflect for a minute, see if your symptoms go away. If not, that's something you need to do something right very quickly. Call 911 and get to the emergency room.